Okay, Dr. Vanderhoff, we'll allow about 30 more seconds for a few more guests to join us, and then I believe we can begin.
Very good, thank you.
All right, Dr. Vanderhoff, I believe we are ready to begin.
Very good. Well, good morning, and thank you for joining us. I'm Dr. Bruce Vanderhoff, the Director of the Ohio Department of Health. Unfortunately, the wave of cases and hospitalizations continues to escalate at an alarming rate here in Ohio, driven, of course, by the Delta variant. Yesterday, we reported 6,823 cases from the previous 24 hours, taking our 21-day reported case average up closer to 5,000. Sadly, the daily case reports upwards of 6,000 and 7,000 are very similar to what we're seeing during our winter surge back in November, December, and January. And while we're not yet at an all-time high of cases reported, these numbers are certainly troubling. In early July, we were seeing daily case rates of 200 and 300. Today, we're seeing 20 times that. We also continue to see rising numbers of Ohioans tested for COVID-19 and increasing positivity rates, now hovering at a 7-day average of 13.3%. Testing is an important strategy to help mitigate the spread of COVID-19. If you're concerned that you might have COVID, there are many options for testing. In addition to being able to get a test at many pharmacies and community providers, we've also partnered with many of our libraries and local health departments, where you can pick up a free, rapid Binax Now test, which can be administered from the comfort of your home with the help of a telehealth provider. Keep in mind that demand for testing is high, so please call ahead to make sure a test is available. You can also search a map on our website, coronavirus.ohio.gov, to find a test provider who is near you. Now, as of yesterday, the Ohio Hospital Association reported that statewide, about 1 in 7 patients in the hospital had COVID-19, and that 1 out of 4 patients in the ICU was battling COVID-19. In rural Ohio, the picture is even more stark. 1 in 3 patients hospitalized is COVID-19 positive, and half of all patients in the ICU are battling COVID-19. The Ohio Hospital Association also shared that the recent surge in COVID-19 hospitalizations is putting a dangerous strain on the state's healthcare infrastructure. We're now seeing hospitals implementing plans to alleviate that pressure. Some have had to reschedule elective procedures, have diverted patients to other hospitals, or have limited patient visitation policies. Yesterday, across the state, there were over 3,000 patients in the hospital with COVID-19, over 800 of them battling the virus in the ICU. Both of these figures are trending in the wrong direction, toward the highs we experienced back in December 2020, and far from what we saw in early July, when the number of patients admitted with COVID was in the 200s, with about 60 to 70 patients in the ICU. Just 1 week ago, I was telling you I was troubled by the more than 2,500 patients in the hospital, and that number has now grown by more than 22% in just the last week. This hospital surge is largely being driven by unvaccinated Ohioans amidst our wave of cases from the dangerous, highly contagious Delta variant. Now, it's common for viruses to constantly change their genetic code through the process of mutation. And that is exactly what is producing new variants like Delta. You may recall that we're able to detect these mutated variants thanks to genomic sequencing, which looks at the genetic code of a virus to determine the strain or the variant. Sequencing is performed on a portion of positive COVID-19 samples collected from across the state, largely because not every sample can be sequenced. First, antigen tests can't be sequenced, only PCR samples can. Secondly, two basic criteria must be met for a positive PCR test to be genetically sequenced. First, there must be enough of the sample remaining after the PCR test is run. And second, there must be sufficient viral load in that sample. If either of these criteria aren't met, the sample can't be sequenced. Hence, not every PCR sample can be sequenced. Genetic sequencing, as you might imagine, also takes time. The entire process of collecting the sample, testing it, sequencing it, and reporting it can take about 3 to 4 weeks, so that data lags. That said, we are able to look at the samples collected and the variants or strains they represent to give us a good idea of which variants may be present in Ohio's population. That's the purpose of genomic sequencing, to give us an overall picture of variant activity in Ohio. We often hear, though, that people want to know if they have a specific variant. They ask, where can they go to walk in and get a test for the Delta variant? Well, given what I just described, you can see that that just isn't practical, nor would it change much in terms of medical decision-making. Sequencing is conducted to give us a better idea of what variant activity we are seeing in the state, rather than to provide patient-specific information. So, when you get a COVID-19 test, you won't find out which variant you're infected with, just whether or not you have COVID-19. Looking at our current numbers, however, you can safely assume your infection at this time is the result of the Delta variant. The prevention methods we've talked about before, however, continue to provide the best protection possible against COVID-19 and all of its variants. Like layers of sun protection, vaccines, masking, and prevention methods work together to protect us from COVID-19. The best protection, of course, is provided by COVID-19 vaccines. Vaccines are the safest and most reliable way to ensure that we have strong protective immunity. Immunity that can reduce the opportunities for this virus to spread, to mutate, and ultimately to inflict serious harm. This is followed, of course, by masking, which prevents respiratory droplets from spreading from one person to another. The next is distancing from others, followed by avoiding congregating in large groups, and prevention methods like improved ventilation and frequent hand washing. These are all further layers of protection. Now, although these methods aren't mandated, these are steps we can all choose to take together to reduce the spread of COVID-19 and to protect ourselves and those around us. Now, again, today, I'm really pleased to be joined by one of my colleagues. Today, Dr. Joseph Gastaldo, Medical Director of Infectious Diseases at Ohio Health, joins me. Dr. Gastaldo, hospitals across the state are sounding the alarm. As COVID-19 hospitalizations increase, we know that that can put a real strain on healthcare workers and hospital systems as they are working to save the lives of Ohioans, not only battling COVID, but also other diseases as well, including those needing critical care. Can you tell us what it looks like now inside our hospitals?
Thank you, Dr. Vanderhoff. Thank you for having me. Good morning, everybody. As everybody knows, we've been in this pandemic now over a year and a half. And the mood in the hospital is really full of emotion. Physicians, nurses, pharmacists, technicians, there is an overall feeling of sadness, physical and emotional fatigue, and frank frustration. To the point Dr. Vanderhoff made before, the vast majority of people in the hospital with COVID are those who are not vaccinated. In the hospital, we are very busy and we are at very high capacity, especially when it comes to taking care of patients, and more importantly, not having enough staff to take care of patients. We are seeing more COVID patients in the hospital, more COVID patients in the ICU, and we are also seeing more non-COVID patients. Many of the non-COVID patients are those people who have had their healthcare delayed from our previous winter surge. A great example of that is a patient I saw recently who came in who delayed a hip replacement because of the COVID surge that we had. From a patient perspective, it's more challenging to be in the hospital in the setting of COVID. There are limitations in visitation capacity, and then even more so for the COVID patient, it's a very challenging way to deliver healthcare. If you are in the hospital with COVID, people come to see you wearing full PPE, wearing a mask. There's challenges with communication. You have very limited visitation. And from a patient perspective, it's not how we were trained to take care of patients. I am a very optimistic person. I do think that in Ohio, we will get through this Delta surge. And once we get through it, hopefully we can get back to doing what we do best and providing healthcare to everybody.
Dr. Gestaldo, you mentioned that the hospitalizations still continue to largely be among the people who are unvaccinated. And I know many people who might still be on the fence are wondering about that question. Should I get a vaccine? How well is it going to protect me from ending up in the hospital? Do I really need to even worry about ending up in the hospital? What can you say to people about vaccination and the protections it affords, and how that's reflected in what you see in the hospital?
Thanks, Dr. Vanderhoff. That's a great question. First of all, I want to say we have 3 safe and effective vaccines, one of which is fully FDA approved. And when you choose to get vaccinated, you are much less likely to get infection compared to someone who is not vaccinated. However, what matters the most with a vaccine? Does the vaccine prevent you from being hospitalized and prevent you from dying? And in that metric alone, the vaccines are performing extraordinarily well. At Ohio Health, for example, roughly anywhere between 15 to 20% of our COVID admissions are those people who are fully vaccinated. However, when you look at those people who are in the hospital with what we call breakthrough infections, there is a similar pattern that you could easily tease out. As an infectious disease doctor, I've known for years that vaccines don't work as well in elderly individuals and with those with weakened immune systems. So when you look at our patients at Ohio Health in the hospital with COVID who are fully vaccinated, there are clear patterns that you can make. Those above the age of 80, we do have more breakthrough infections in the hospital in those particular patients. That's not surprising at all, knowing that vaccines don't work as well in that age category. People with weakened immune systems, transplant patients, those receiving active treatment with chemotherapy for cancer, certain biological agents for psoriasis and other autoimmune diseases. Vaccines don't work as well in them. And those are the types of patients that we are seeing in the hospital with breakthrough infections after being fully vaccinated. Clearly, however, people who don't have those health conditions, who are not fully vaccinated, we are seeing many of those in the hospital. What's different really about it this time is the fact that because of the way we had the vaccines first come out in the state of Ohio due to limited supply, we are seeing younger people in the hospital with COVID. Younger people have not had the same degree of access to vaccines. So really, I'm asking everybody in the community, to follow the mitigation recommendations. If you live in an area of high or substantial community spread of COVID-19, and in Ohio, that's all 88 counties, please wear a mask. If you have not yet been vaccinated, please get vaccinated. By getting vaccinated, you are going to help us in the hospital. You are much less likely to get infection, and you're much less likely to be hospitalized if you get infection with COVID-19.
Thank you, Dr. Gestaldo. I want to build on some of the points that you made. We've been in this battle now against COVID-19 for a long time. And we're now at a place where there's quite a bit of a spotlight on some of the mitigation steps that were so important in the past for us, things like masks. Can you share a little bit more about how respiratory viruses like COVID-19 actually spread, and why strategies like masking, distancing, ventilation can still be logical, smart responses for us to take, and maybe carry that a little further into, and are there times when vaccinated people also might want to consider taking on a mask?
Yeah, that's a great question. So let's dive into that. So SARS coronavirus 2, influenza, and other respiratory viruses are predominantly spread through droplets. If I talk, if I sing, if I cough or sneeze, I'm putting droplets into the air. In the setting of COVID-19, some of those particles are actually smaller and can stay suspended in the air. For somebody to get infection, remember it's a respiratory virus, a droplet that has virus in it has to come in contact with cells either within your eyes, your nose, or your mouth. So we have mitigation strategies that synergistically or additively work together in helping mitigate catching COVID-19. We talk about wearing a mask. The science is clear on wearing a mask. Is mask wearing perfect? No, it's not, but it is an important mitigation recommendation. Masks have two goals. Number one, they do protect the wearer in the setting that if somebody coughs or sneezes on me, it'll hit the mask instead. It also protects those people around the person who's wearing the mask in the setting of them having symptomatic or asymptomatic infection. Another mitigation recommendation that's very important is paying attention to the ventilation of air. It's all about dilution. So if you are coughing or sneezing or putting virus into the air, if the air is circulating, if the air is moving, it's going to be diluted and the virus is going to be whisked away. Physical distancing and social distancing is also a very important mitigation recommendation. Washing your hands. And then most importantly, another piece of armor in protecting yourself is getting vaccinated. Synergistically, additively, all of these things work very well together in helping you not get infection with this contagious virus.
Thank you, Dr. Gestaldo. Well, in conclusion, I think we all need to remember that our hospitals, our healthcare infrastructure is absolutely essential. And it becomes ever harder for our doctors and nurses and other healthcare providers to provide that essential care to us as Ohioans when the hospital is inundated by COVID-19. To help alleviate this pressure on our hospitals, we must all do our very best to prevent the spread of COVID-19. When we choose to be vaccinated, it helps keep us out of the hospital, allowing our hospitals to continue giving crucial care to our state's children and adults who may be in need, and to save lives. Now, I'd like to open it up for questions. Alicia?
Thank you, Dr. Vanderhoff. Our first question today is from Dan DeRose with WOIO.
Good morning, Dr. Vanderhoff.
Good morning.
I'd like to talk about schools. What are you hearing as the head of the Ohio Department of Health? What is the health of our schools now that we are 1, 2, 3 weeks back into school? Are you hearing, are you getting reports of schools that are having having to quarantine mass amounts of students who are infected positive? And is the dashboard for the ODH still recording and being updated for those kinds of numbers?
Thanks for that question. Yeah, what we're hearing is exactly what one might expect we would be hearing. And that is that so many of our schools that have opened the school year and have not taken our guidance to heart and had comprehensive plans for COVID safety that include masking and social distancing are finding large numbers of their student body and staff requiring quarantine. And now, in response to that, many of those that opened without those safety measures in place are turning and placing those safety measures in their schools. So, I think the message that Dr. Gastaldo and I have shared today is that this really all comes down to all of us thinking very carefully and seriously about COVID-19 as a respiratory virus that is very infectious and that we have ways to prevent spread. One, of course, is vaccination. And thankfully, many of our students 12 and up do have access to vaccination. We strongly encourage that. But for so many of our students, they either aren't vaccinated or are not eligible for vaccination. And using some of the common sense, logical steps to help prevent the spread of a respiratory virus becomes a prudent step. Dr. Gastaldo, anything that you might add?
Yeah, thanks, Dr. Vanderhoff. One thing that I would be remiss if I didn't mention, in areas where there is more vaccinations of adults, there is less of a COVID risk for children. And when you look specifically at each individual county in Ohio, there's different vaccine uptake. So counties that have higher vaccination rates are expected to have lower COVID within their school communities. And we really want to surround children with all of the mitigation recommendations as appropriate. They're additive. 12 and above should be vaccinated. Teachers should be vaccinated. Communities should be vaccinated. That's the pathway to keep children in school.
Thank you, doctors. Our next question is from Spencer Hickey with Hannah News.
Thank you. And if you'd be able to answer this for Ohio in general, or specifically to Central Ohio with the doctor from Ohio Health, can you talk about, given the surge, how close individual hospitals have come to reaching capacity for patients, ICUs, or ventilators at this time?
Sure, I'll answer it globally for the state. And so as we look at the numbers and we look at the data that's coming to us from the Ohio Hospital Association, it's really not been primarily an issue so far with this surge of physical capacity or supply capacity. We have had instances where we have had to move ventilators out of our reserve into hospitals that were running out of ventilator physical capacity, but we've had plenty of available ventilator within our zone network that we've had long established. So it's not been primarily that as an issue this time. It's really been a challenge for us in terms of staffing. And we are running up against real challenges just in terms of the wear and tear that this long pandemic has had on our healthcare providers, our frontline providers, and the ability of our hospitals and health systems to maintain this very, very high pace of work and activity over the long, long haul. So fortunately, in Ohio, we have a very robust network of collaboration and coordination among our hospitals for purposes of assuring good and timely patient care. So while there is still margin in our system overall, steps are having to be taken that I think we want to ultimately avoid. And I mentioned those at the beginning with some elective cases having to be postponed, with some services that might normally be available at a location on an outpatient basis, needing to be shifted to another location, et cetera. In terms of specifics, Dr. Gastaldo, anything that you might be able to share from your experience in Central Ohio?
Sure. So within Central Ohio, like Dr. Vanderhoff said, bed capacity is fine. We are trying to walk and chew gum at the same time. And each hospital is really walking a fine line, trying to really juggle taking care of COVID patients and taking care of non-COVID patients. The biggest stress on the capacity is not beds, it's the staff. Like I said earlier on, healthcare workers are physically and emotionally fatigued. Taking care of COVID patients is emotionally very challenging, and it really is having impact on healthcare providers' resiliencies. Now, speaking of which, all hospital systems, including Ohio Health, is really building robust mechanisms to really support our associates as best as we can to allow them time to take care of themselves. We need all hands on deck. And like I said, it's not a bed capacity issue, it's more of a staffing capacity issue.
Thank you, doctors. Our next question is from Chelsea Sick with WKEF.
Morning, doctors. Public Health Dayton and Montgomery County just announced yesterday it would start giving $100 to those in the county receiving their first COVID-19 vaccine. The county says it's getting that money from ODH. Can you just explain more about where that money is coming from? And do you think more public health departments should start doing the same thing?
Well, yes, thank you for that question. It has been clear over the course of the last period of weeks that our local providers, many of our local health departments, are best positioned to work with their communities and offer some incentives for vaccination for some of the people who may be on the fence. And therefore, we have worked in advancing dollars that ultimately have come to us from the federal government for the purpose of supporting the response to COVID-19 and including encouraging vaccination, and have been able to help support these incentive efforts like the one that you were describing. And we've been very gratified by the impact that these local programs are having in communities. Community after community telling us that they're seeing a definite uptick in vaccine delivery as a result of these incentive programs. So that's how that process works. And we're very pleased that it's a part of the effort that is leading to increasing vaccine numbers here in the state.
Thank you, Dr. Vanderhoff. Our next question is from Larry Seward with WCPO.
Doctors Vanderhoff and Gastaldo, good morning to you. We have a middle school temporarily closing because of an overwhelming number of active COVID-19 cases among teachers and staff. There remains no mask mandate in this district, where administrators are admitting seeing evidence of school-related transmission. In this environment, is optional masking smart? Should they mandate masks or move to remote learning? And what is the risk by remaining mask optional in such an environment?
Well, I think that in my closing comments, I really did address just how important it is for schools to be looking at the ways that they can most effectively keep students in school. In-school education, we now know, is extremely important. It's important for students' academic development, for their personal development, for their emotional well-being. And so therefore, our objective is to keep our kids in school, in person, learning as much as possible. But we understand that this is in the context of COVID-19, which is a very serious public health concern, and that this has to be approached in ways that provide for a safe environment. And we've already laid out in our guidance 3 different ways that school districts can think about having their students in school while avoiding the risk of quarantine. And first, student and staff members can be vaccinated, and fully vaccinated people are able to avoid being subject to the quarantine requirement. Secondly, schools can, as they did last year so successfully, require masks and other COVID-19 safety measures, including distancing, and thereby avoid the need for quarantine. And then finally, even in a situation where a school may not be adopting the safety measures of masking and distancing that we used so successfully last year, parents can make the decision to ask their child to mask at that school. And in doing that, while also trying to maintain some reasonable distance from others, they're insulating themselves from the risk of that quarantine requirement. So it really comes back to the basics, and those basics can make all the difference in terms of the ability to keep our students in school. Dr. Gastaldo, as an infectious disease doctor, do you have anything you'd like to add to that?
Just to say clearly, Dr. Vanderhoff, that kids need to be in school, and school districts need to use all layers of protection in their armamentarium. Those include mask wearing, distancing, paying attention to ventilation, and vaccinations. There is no physiological harm for a child to wear a mask. I actually think it's going to be more harmful for them to have remote learning, or God forbid, they require a hospitalization of COVID-19. But we really need to think about back to basics. How can we keep kids in school safely with the basic mitigation recommendations that we all been living with for the last year and a half?
Thank you, Dr. Gastaldo. Our next question is from Jess Harden with Mahoning Matters.
Hi, Dr. Vanderhoff. Thanks for taking our questions today. 2 weeks ago, when I asked if you'd recommend Governor Dewine issue a statewide mask mandate, you emphasized personal responsibility and said you believed that people would do the right thing. And it's pretty clear that they're not. In almost any public space in the Mahoning Valley this summer, very few people are wearing masks. And since I last asked, statewide daily counts are up from 4,800 cases each day to about 7,000. What's your specific medical for not?
Jess, we can no longer hear your question. If you'd like to go back to asking your question, please.
Can you hear me now?
Yes.
Yes.
Jess, we could hear you. Are you able to speak up?
Hello? Can you hear me now?
Jess, we can hear you.
Okay, thank you. I was saying that I asked 2 weeks ago if Dr. Vanderhoff would recommend Governor Dewine issue a statewide mask mandate. He emphasized personal responsibility and said he believed that people would do the right thing. In almost any public place in the Mahoning Valley this summer, there are very few people wearing masks. And since I last asked, statewide daily case counts are up from 4,800 each day to about 7,000. What's your specific medical reasoning for not going to Governor Dewine with your recommendation for a new statewide mask mandate?
Well, I think that we need to be clear on what I have said and what I am recommending. And I'm recommending that we all take the steps that are necessary, proven, and important for protecting ourselves, those we love, and our communities from COVID-19. First and foremost is vaccination. Look, the way out of this pandemic, in fact, the way out of any pandemic of a highly infectious disease, is through immunity. Immunity is what is going to turn this from something that is in a cyclical way causing us to have our healthcare infrastructure challenged and people end up in the hospital, et cetera. From that to something that is more endemic and more mild in its nature, immunity. How do we get immunity? Well, the safest way to get immunity, the most reliable way to gain immunity is vaccination. So first and foremost, for those for whom vaccines are available, we recommend vaccination. And as more and more people get vaccinated, the ability of this virus to cause the harm that we're seeing it cause is reduced. The ability of this virus to transform, to mutate, to bring new variants into our community becomes less. So vaccination is our first and most powerful weapon. We are strongly encouraging that. Secondly, we can take steps to reduce the physical spread of the virus. That's masking, distancing, being mindful of if we are in crowds or indoor spaces, and we continue to recommend those. However, in order for any of that to work, it is the people of Ohio who have to make it work. It is the people of Ohio who have to choose those paths towards the brighter future. And we have to recognize that this is a democracy. And in a democracy, people have the right to govern. And they have made it very clear that there is a low tolerance for mandates. As a result, we, as me, my colleagues who I bring on to these press conferences, we continue to offer the best medical guidance that we can to the people of Ohio. And that's what we're doing. We're telling people what we as doctors know they can and should do to keep themselves and those around them safe and healthy.
Thank you, Dr. Vanderhoff. Our next question is from Jackie Borchert with USA Today Network, Ohio.
Good morning. Thanks for taking my question. Many experts are now saying that COVID will be endemic and we'll keep seeing spikes and surges for some time. Have we reached this point in Ohio? And if not, how far are we from that phase and how is the state preparing for it?
Well, I think it's an excellent question. And I would agree that we are on a path towards this virus becoming an endemic virus, one that we are able to live with and able to live with much better. That is why I was referring to the importance of immunity and our ability to develop immunity. I'm very pleased that now more than half of eligible Ohioans have in fact rolled up their arms and began their vaccination series, that they've gotten that first dose in arm. And I would encourage more Ohioans to consider that path. It is the beginning of our ability to essentially defang this virus, to declaw this virus, and make it something that we're able to live with much more safely. And so what are we doing to prepare for that? Well, one and probably the most important thing is something we've seen us doing now for quite a while, and that is vaccination and making vaccinations readily available to people all across the state, in every county of the state. Another, of course, is our continued efforts to make testing available so that if somebody is concerned that they might be sick and wants to have more information about their own health, they can get it. And so you see more of the testing that's available. But at the end of the day, this is really all about immunity. And since Dr. Gastaldo is an infectious disease doctor with special expertise in the immune system, Dr. Gastaldo, what would you add to that?
Yeah, so thank you, Dr. Vanderhoff. And you're right, I just want to reiterate, the pathway to the pandemic ending is immunity. And the safer way to get immunity is through a vaccine and not getting COVID. But as time goes on, we're over a year and a half into it, there are more people with immunity today than there was a year and a half ago. So we are actually beginning that process now as we get more immunity in Ohioans. Moving forward too, I do expect a Tamiflu type pill available for COVID-19 sometime tentatively, hopefully by the end of this calendar year. So really, you can kind of see the pathway happening that this specific coronavirus turns into an endemic virus, very much like influenza, where we see more activity, more so in the winter months. You get tested, you maybe get a booster every couple of years. We don't know that yet. We're going to have pills available to treat this. So it's a virus that we have to learn to live safely with. We need to stay on top of information. We need to respect and study the variants. More variants are likely to come out, but we need to learn safely with this virus and provide people the information they need so they can know what to do to be safe.
Thank you, Dr. Castaldo. Our next question is from Laura Hancock with cleveland.com.
Hello, Dr. Vanderhoff. I know that a very small amount of new variant has shown up in genomic sequencing here in Ohio. I'm seeking the exact number, like you provided numbers of the Delta variant showing up in sequencing. Also, if you could talk a little bit about the concerns of Mu with that early study showing it's able to escape vaccine antibodies.
Yes. So I'll open up and then I'll turn to my colleague, who again is an infectious disease doctor, and I think can go into considerably more detail. So as you can imagine, along with the CDC, we monitor for both variants of concern, things like Delta that we know can be a problem, and variants of interest, and that includes the Mu variant, the Lambda variant. Both Mu, which is B1621, and Lambda, which is C37, both have been detected in Ohio, but as you said, very, very low proportions. The last numbers that I have show both of these present at mere fractions of a percent. And I'm sure that our staff can get you more on that offline, but they're mere fractions of a percent. Here's what we know about Mu and Lambda. They're being seen in just all over the world and all over the country, but they don't seem to be growing in the face of the Delta variant. And we saw this with some other variants of interest and even variants of concern back with Alpha. There seems to be this pattern of these very aggressive, highly transmissible variants crowding the other variants out of the picture. The other thing is, in terms of the ability of some of these variants of interest, like Mu and Lambda, to reduce the antibody response, we have to take that with a little bit of caution, a little bit of grain of salt, because that's not the whole story. We've seen that those other variants, take for example the South African variant and the Brazilian variants, both of those had that ability as well, and they were never really able to outcompete Alpha in the picture. So that's one consideration. The other is that's not the totality of immunity, and we're now coming to understand that cellular immunity is far more important. And even when there's been a reduction in sort of what I would call laboratory assays looking at the antibody response, it's still usually not been enough to render the vaccines anywhere near ineffective. So I'll turn to Dr. Castaldo because this is really his specialty. Dr. Castaldo, what more can you tell us about Mu and Lambda?
Yes, thank you, Dr. Vanderhoff. First of all, I want to say is we are going to have more variants. We will likely get through the whole Greek alphabet. As we have more infections, we are expecting more variants. Remember, what's driving variants or mutations are people getting infection, those people who have not been vaccinated. So really, We are going to see more variants. We will likely see them more in areas and parts of the world where they have not yet vaccinated. And like you said earlier before, Dr. Vanderhoff, we have to be very careful when we hear the headlines in the news about test tube studies looking at neutralizing antibody levels. There's more to the immune response after you get vaccinated than the antibody level that's induced. For example, I was vaccinated in December of 2020. My antibody levels naturally come down, and by having lower antibody levels, I may be at higher risk of getting infection with the Delta variant. However, the cell-mediated immunity, I have that from being vaccinated. If I get infection with a Delta variant or another variant, my cell-mediated immunity will kick in, I'll clear the virus, and I will have a wonderful layer of protection against a severe outcome. So I'm still well protected against that. You know, the canary in the coal mine that we're always looking out for, and the CDC has mechanisms for this, are people being admitted to the hospital who are fully vaccinated. Now, hypothetically, if all of a sudden we see people who are fully vaccinated in the hospital, who 100% of our admissions are those fully vaccinated, that's a different scenario. But realistically, I don't see that happening. We need to monitor for variants. We need to respect the variants and study them. But every time a new variant is identified, we just need to make sure we understand what that means. And right now, there is no signal that the new variant is going to take over. It's all about Delta now, and having such a high transmissible variant, the Delta variant, it's kind of keeping the new variant in check.
Thank you. Our next question is from Jackie Orozco from WSYX.
Morning, guys. I just have a two-part question. So what do you think about Mayor Ginther's mask mandate for everyone in the city of Columbus, regardless of vaccination status, and President Biden addressing the country later on today regarding his 6-pill plan to fight COVID?
Well, this is Bruce Vanderhoff. I have not read the president's plan yet, so I really can't comment on that. And in terms of the mayor's mask order or mandate, certainly here for the Department of Health, our facilities that are in Columbus, we will be acting in a manner that is respectful of that order. Dr. Gastaldo, you're in Central Ohio and have facilities there. What would you say to that?
Yeah, so within Franklin County, specifically the city of Columbus, we are having a lot of COVID, and I'm supportive of Mayor Ginther's leadership on having an executive order for wearing a mask in public indoors. It's really all about protecting the hospital capacity within Central Ohio. And it's not only the city of Columbus, but overnight, the city of Bexley and Whitehall have also instituted mask requirements within their municipalities. And again, it's all about protecting our local regional hospitals. We have a lot going on in the hospital, and we're really trying to provide appropriate care to our communities for COVID patients and non-COVID patients.
Thank you. Our next question is from Joe Ingles with Ohio Public Radio and Television.
Hello, doctors. Thank you for doing this. I wanted to ask to see if there is anywhere that we can find a comparison between vaccines among hospitalized people and those who have had deaths in breakthrough cases. A lot of people are asking me which shot is most effective, wanting stats, wanting data. I have no stats, no data. Do you?
Yeah, I think that the best answer to that is to look at the national research and the information that comes from the CDC. Making those kinds of discernments between vaccines is extremely difficult and requires large numbers. And that is why the ACIP has been charged with a lot of that work. Thus far, the information that's available to us suggests that all three of the vaccines are doing an outstanding job. To answer your question scientifically would actually require a head-to-head trial between vaccines. And to my knowledge, that has not been conducted anywhere in the world. But it's a little bit of a distinction without a difference, because the reality is we don't have any data signal at all that suggests that any of our vaccines are failing to provide exceptional protection against their normal natural endpoints of serious illness, hospitalization, and death. They're all working fabulously, all three of them. So, and that is based on national data, as well as the local data here in Ohio. So there's just no indication of a problem. In fact, it was the basis for a lot of the statements that came from prominent members of the National Academy of Science about the importance for the FDA Advisory Committee to meet and further review the data before even providing a clearance for consideration of booster doses. Dr. Gastaldo, again, this is right up your alley as an infectious disease expert.
So thank you, Dr. Vanderhoff. You know, if there was an advantage of one vaccine over another, I feel confident that the CDC's Advisory Committee of Immunization Practices would say that. And to date, there is not one vaccine that's recommended over another. And what matters the most is the vaccine keep you out of the hospital. They all perform exceptionally well. And again, I know when you go online and read different studies, you'll find studies that says the Moderna study gives you higher antibody titers than Pfizer and this, that, the other. You really have to take those studies with a grain of salt, because each study population is very different as far as the age, when they were vaccinated, et cetera, et cetera.
Thank you, Dr. Gastaldo. Our next question is from Amani Abraham with WKYC.
Hello, good morning. I wanted to touch on the demand and the availability of the rapid tests in the state. Our local health department here in Summit County, they announced that they ran out of kits today, but they're expecting a new shipment soon. Can you explain the demand you're seeing and how many tests have been distributed to libraries and local health departments? And, how many more would be distributed soon to those organizations?
Yeah, so the availability, so the Binax Now tests, we've been distributing actually for quite some time to libraries that have chosen to participate, as well as to local health departments and other channels. The demand, as you can imagine, has grown very rapidly, very quickly. And we have generally worked to make those tests available in very short order, a matter of days. And we're continuing to work very hard to maintain that level of turnaround or customer service. So while I'm sure there may be a location here or there that has experienced a delay due to sudden a bolus in demand, we're trying to be very, very responsive to that. In terms of overall numbers, we had, at my last check, in the neighborhood of 1 million or so of these Binax Now take-home tests still available, and we continue to work very hard to get those out to locations as needed. So that's the best answer I can offer you now. It's a pretty robust capability.
Thank you, Dr. Vanderhoff. Our next question is from Anna Huntsman with IdeaStream Public Media.
Hi there. I was curious if you could speak to any regional differences about the hospitalizations and the challenges we're seeing hospitals have across the state. We've heard anecdotally that the Cincinnati and Columbus area hospitals are faring worse and having to suspend those elective procedures. But how are things going in the northern region of the state? Are we at that level yet? Are we behind the southern regions? Any info you could share would be great.
Yeah, I think that your observations are consistent with mine, and just looking at the state data and state information, and actually consistent with experience across the country. This wave, for reasons that are not completely understood, has really been a southern wave, and it has moved up from the south, and that has been true in Ohio as well. So the wave hit the southernmost portions of the state before it hit the northern portions of the state. However, we're seeing growing volumes also now in the north. I was just on one of our coordinating calls with our hospitals on yesterday, and our northern hospitals affirmed that now they're also beginning to see rising case volumes. So I don't think that this is a wave that is sparing any part of the state. I think it is simply a wave that is moving in time from the south to the north. Dr. Gastaldo, you're there in Central Ohio. What has your experience been?
Yeah, Dr. Vanderhoff, I agree with you wholeheartedly. You know, if you think about metropolitan Cincinnati and metropolitan Columbus, our care areas are Southern Ohio, and Southern Ohio counties are counties with lower vaccine uptake. And here at Riverside Methodist Hospital, we do get patients with COVID who get sent our way from those communities with lower vaccine uptake. Your point is well taken. Again, the Delta variant in our country began in the Missouri, Arkansas area, an area with lower vaccine uptake, and it is spreading north. And what's that going to look like once we get to states with higher vaccine uptake? My hunch is that they will still see more COVID in those who are not vaccinated, but it's not going to be as tough on areas of higher vaccine uptake, specifically in the northeastern geography area of our country.
Thank you. Our next question is from Pete Grieve with Spectrum News. Pete, it appears you're unmuted, but we can't hear you. All right, I'm going to go ahead and move to our next question. Christian Hauser with WKRC TV, and we'll try to get back to Pete if we can. Christian Hauser from WKYC or KRC TV. All right, and I looked like Pete. Can you try to unmute yourself and see if we can hear you now? Otherwise, this might be our wrap up for the day.
Can you hear me?
We can hear you now, Pete.
Hi, I was wondering if you could provide an update on the the plans for a pilot program with Warren County schools, as far as keeping exposed students in school if they wear a mask.
Yeah, I'd be happy to. So, going back to what I said before, we consider it to be a very high priority to keep our kids in school, in person, learning as much as possible. Again, I won't repeat the quarantine guidance that we've offered that really provides every student, every parent with 3 potential pathways to keep that student out of quarantine today that involve either vaccination or masking. But in addition, we're also examining an alternative to traditional quarantine that focuses on a combination of masking with distancing and frequent testing through a pilot program that is currently limited to 10 school districts coordinated by the Warren County Health District. If we find that that experience is favorable, and we have reason to believe from literature that it has been available from other parts of the world that it might very well be, then we would look to expand this opportunity statewide to schools and local health departments who would feel this would be an appropriate alternative for their district and their community. But at this stage, we want to examine it closely before we would move further.
Thank you, Dr. Vanderhoff. Our final question is from Christian Hauser with WKRC TV.
Hi, can you hear me okay now?
Yes, yes, indeed.
Yes, okay, great. I'm asking this question on behalf of Christian because he's doing a live shot right now. This is Mike Horsley, the news operations manager. We wanted to get your take, Doctor, on President Biden's address to the nation later. He's expected to announce mandatory vaccines for all federal employees and contractors, and also expected to call on state and local governments as well as businesses to try to implement mask mandates and even vaccination mandates. We just wanted to get your take on those proposals and see if the state plans on doing anything in terms of requiring workers to get vaccinated.
Well, I think we've been consistent in our message that as a state, as the Department of Health, it is our role to provide the people of Ohio with the best information we can about the ways that they can protect themselves from COVID-19, and that the very, very best way is vaccination. So I'm a big vaccine enthusiast. I, of course, been vaccinated. My family's been vaccinated. I could not, as a physician, believe more strongly in the benefits of vaccines for COVID-19. But I can't comment on what the president is going to say. I don't know what he's going to cover. I can only say that as the Ohio Department of Health, our role has been to provide all of you with the best information we can about getting through this pandemic and getting through it in a way that keeps you safe and healthy, and then keeps you healthy into the future. Because as Dr. Gastaldo and I have shared, COVID's not going away. COVID is with us for the foreseeable future. And so therefore, what we all need is to be immune to COVID-19, protected through our immune systems from COVID-19. And the best, the safest way to accomplish that is to get vaccinated.
Thank you, Dr. Vanderhoff. That was our final question for today. If you would like to share any closing remarks, please feel free. Otherwise, we thank you all for joining us.